instead of care. NHS patients pushed to the back of the queue by those with fatter checkbooks, and a postcode lottery of provision. And it will also mean wanted, wrong for the public and wrong for Britain. And that's clear because, remember what David Cameron said? There'll be no top-down reorganisation of the NHS.
Hypocrite!
Well, what we've got is now reforms that the chief executive of the NHS says are so big they can be seen. And David Cameron said too, didn't he, that the health service would be safe in his hands. Instead, we've got the biggest, most dangerous upheaval in the 64-year history of this.
They throw grenades right into the heart of healthcare in our country. An ideological attack to break up our National Health Service. A reorganisation which will turn our National Health Service into trying to make as much money as they can from patients that pay for their care. Is that what we really want?
No!
And we all know what will happen. Private patients first. The rest of us at the back of the queue. Compassion replaced by competition. And for patients, not for our members, not for the workers, but for patients, a postcode lottery, rationing of operations, children's services at risk, care of the elderly to get worse. And I don't know about you, but I want my GP thinking about what is best for me and my family, not what's best for his budget and for his wallet. We don't want changes, Nick. We want this bill absolutely scrapped. Fair State, our National Health Service, a beacon to the world, the proudest achievement of our movement. And if there's money to bail out the banks, and if there's money for bankers' bonuses, and if it's all right for the richest 1,000 people in this country to increase their wealth by 30% in the last year alone, then there's money available for our health services.
England each year grew by over 120,000 in the last decade, and is projected to rise by another 35,000 during this Parliament. Being required makes no difference, and I know from my experience that when private services run alongside NHS services, the NHS women suffer. Believe me that if you are a head of midwifery on a busy day on a labour ward with too few midwives, you will feel obliged to ensure that the paying women have one-to-one care in labour. The other women will have to share the chest. It is time to kill the bill.
Now are policies that would restrict our clinical freedom and the clinical freedom of doctors to act in the best interests of their patients. Possible health and social care. And that's why we oppose this bill, because competition and this obsession with the market in healthcare will splinter, will fragment, will undermine the joined-up care. We must stand together. The VMA has never said that the NHS doesn't need to change, but not in this way, not at this time, and not with this bill. This bill was supposed to be about listening to doctors, listening to nurses, and listening to patients. Well, Mr. Cameron, well, Mr. Lansley, are you listening? we're telling you, we didn't ask for this bill, we don't need this bill, and we don't want this bill. But if you don't listen, it will be. Stop this bill now.
Of my life, I was born under the NHS, grew up under it, and I also had my children in an NHS hospital. And this, as a nurse, psychiatric nurse myself, I remember the changes happening in the 80s when, for example, cleaning services went out to tender, and for the lowest possible amount of money, and these poor women came in and were working for peanuts. It was absolutely appalling. And I have to say, when I gave birth, the room that I was in, there was a bit of a mess, there was some blood on the walls, but that was because my husband and I had a fight just before the baby came out. Although I have to just say, one thing I loved about being a nurse was the humour of nurses. Nurses do not do it for the money. They are wonderful people who are a laugh and they care. Poem by Jenny Joseph about not being invisible as an elderly person, which first line is, when I'm old I shall wear purple. Well, I've decided when I'm elderly I'm going to be an alcoholic, so that when I am old I will be purple, and I'm looking forward to that. Now, I have to say, the NHS works in so many different areas of health, and I think preventative medicine is a big area that will be neglected in the future. And I have to say, a lot of people say to me, you know, if you could take a pill that would make you lose weight, would you take it? And I say, of course I would, you know, I'd like to take a pill that would make me 6 stone. Then I could eat my way back up to 10. What a fantastic weekend that would be. Now, I personally feel this government is very, very dangerous indeed, and we need to stop them.